We've been misled by this false narrative that heart disease is caused by cholesterol, and it's not. Cholesterol is actually trying to fix the problem.
Do you think that a high-fat diet could actually fix heart disease?
Yes, I've seen it. Eating a lot of those fats in combination with animal protein, I've seen it improve heart disease.
Dr. Philip Ovadia is a world-leading heart surgeon, best-selling author, and international speaker.
He is on a mission to fix heart disease, and it starts with eating more butter.
Heart disease should not get to that advanced stage where you need me to open up your chest and do this very invasive surgery. We know what is causing heart disease. We know how to reverse the cause of heart disease. It's really inexcusable that we still continue to have heart disease to the magnitude that we have it.
What do you think about red meat in the sense of heart disease? Does it cause heart disease?
Absolutely not. 100% red meat does not cause heart disease. It never has. It never will.
I like to play a game here. I'm going to give you some foods and you tell me, can you eat as much of this and that's going to help someone fix their heart disease? First one, beef.
Definitely so.
How about eggs?
Definitely so.
How many can you eat a day? How many eggs?
I don't know that there's a limit. I have become a little bit more cautious.
Okay, any limit on salt if somebody wants to fix heart disease?
If it's real salt, there's no limit. If it's processed salt, that's where it becomes problematic.
This episode features Dr. Philip Ovadia, and we're discussing the natural way to fix heart disease, and it involves eating more butter. Now, if you're learning from and enjoying these free episodes, please hit the subscribe button because we know that real food is medicine, including butter. And by the simple act of subscribing, you can help share the message to millions more people that need to hear the truth. And now for the episode with Dr. Philip Ovadia. Dr. Ovadia, welcome.
Great to be back here with you again, Rena.
When it comes to heart health, most likely your doctor will tell you, eat less red meat, eat less butter, don't eat saturated fat. But what if this was the reason why you were more likely to get heart disease? So in this episode, Dr. Philip Ovadia is going to share the truth behind what causes heart disease, why you need to eat more butter, more saturated fat, and why you need more cholesterol, but the right type of cholesterol, and also the 5 metabolic markers that you need to know your risk of heart disease. So Dr. Ovadia, my first question. You are a heart surgeon and you've performed over 3,000 heart surgeries. You're also a best-selling author of Stay Off My Operating Table. Is heart disease preventable?
I definitely think it's preventable. You know, the way that I look at things these days, the people that end up on my operating table, each one of them is a failure. But it's not that that person has failed. It's that the medical system has failed them, because heart disease should not get to that advanced stage where you need me to open up your chest and do this, very invasive surgery. And it really shouldn't get to the stage where you even need stents or anything like that. We know what is causing heart disease. We know how to reverse the cause of heart disease. And therefore, it's really inexcusable that we still continue to have heart disease to the magnitude that we have it. You know, it's still the number one killer here in the United States. It's the number one killer worldwide. And it really shouldn't be that way. And that's, why I'm on the mission that I'm on, to keep people off the operating table, to keep them from needing heart disease, from having heart disease and needing that surgery.
So when you say that we have been failed, is that by our healthcare system? And how have each and every one of us watching been failed or even lied to by our healthcare system?
Yeah, we've been failed by it because, like I said, this is a preventable disease, and the people aren't getting the information they need to prevent the disease. And honestly, I don't even blame the doctors, because the doctors aren't getting the information that they need to give the people to prevent disease. We've been misled by this false narrative that heart disease is caused by cholesterol, and it's not. Cholesterol plays a role in the process of heart disease, but it is not the cause of heart disease. The cause of heart disease is damage to your blood vessels. And that damage to your blood vessels can be caused by a number of different things, but they're all, knowable and preventable and reversible. So if we focus on what's damaging the blood vessels, that's what's going to allow us to eliminate the heart disease.
Absolutely. I want to talk about these different things that are very easily identifiable and reversible to fix heart disease. Let's talk about cholesterol because, as you mentioned, it's a myth. The first question for you, for people to understand that cholesterol does not cause actual heart disease. As a heart surgeon, when you actually open up the heart and you're looking at an artery that is in the heart and it has plaque in it, what are you seeing? What is that plaque?
Yeah, and this is what kind of has fooled us, right? Because there is cholesterol in that plaque. There's other stuff in that plaque as well, right? There's people will be familiar with the calcium that occurs in there, calcified plaque. You can see evidence of bleeding or blood clots that have occurred within that plaque. There's lots of stuff that's in that plaque, but we got focused on the cholesterol part of it. And we assumed that, we see cholesterol in the plaque, we see cholesterol in the blood. And therefore, if we somehow get the cholesterol out of the blood or don't let the cholesterol get into the blood in the first place, that's going to be the way to prevent the plaque. But it turns out that, again, cholesterol isn't causing the problem. Cholesterol is actually trying to fix the problem. The problem being damage to the blood vessel. And the cholesterol comes to try and fix that damage. And what happens is when the cholesterol itself is dysfunctional, it now causes a further inflammatory reaction. And that's what then starts this buildup that leads ultimately to the plaque. But again, focusing on the cholesterol is the wrong approach. We have to go back a step and focus on what's damaging the blood vessel.
Okay, so when you talk about the cholesterol can become dysfunctional, are you talking about oxidized LDL cholesterol?
We're talking about oxidized LDL. We're talking about the small, dense LDL. We're talking about the VLDL, which is another type of cholesterol carrying, particle. And these are the ones that, cause the trouble. But that doesn't mean that all cholesterol is problematic. When we look at things like large cholesterol particles, large LDL cholesterol particles, that's how the LDL is supposed to be. And when large LDL particles are doing what they're trying to do, repair a blood vessel wall, for instance, they are able to do that and then disappear. They don't cause this buildup of plaque. It's only that dysfunctional LDL and those VLDLs that get stuck in the blood vessel wall and then lead to the plaque formation.
Absolutely. I'm thinking of somebody that gets their blood work done. They have the cholesterol number, they have the LDL number, and maybe their doctor might freak out, especially if those two numbers are high. What should they ask for and look at when it comes to cholesterol pertaining to LDL cholesterol?
Yeah, so you really want to know what type of LDL cholesterol you have. And that's going to involve something called, it's either called an advanced lipid panel, or you might hear it called an NMR panel, nuclear magnetic resonance. Sometimes it will be called lipofractionation. But what we're trying to get at is, what do those LDL particles look like? What are their sizes? You can also test whether or not they're oxidized. You can do a test for oxidized LDL. Now, that test is the test itself is a little problematic, and so I don't usually get that one. And we could talk about why that is. In theory, right, you do want to know about oxidized LDL cholesterol. The problem is the way that they do that test, they don't really index it to how much cholesterol that you have. So if you have a lot of LDL cholesterol to start with, and you get that oxidized LDL test, it may still come out in what's considered the high range, But, it could still be a small percentage of your overall LDL that's oxidized, and that might not be a worrisome situation.
Okay, so understanding the difference between the small dense LDL, the large buoyant LDL, when it comes to atherogenic plaque, plaque in the arteries, that is going to be an indicator if somebody has inflammation. So we need to do further testing. Don't just look at the LDL number. That's very, very important. So, question for you: you're a carnivore heart surgeon. I'm a high fat carnivore, just in general. When we do carnivore diet or a keto diet, why does our cholesterol increase and our LDL increase in some people?
Yeah. So, and it's key what you said at the end. In some people, the studies actually show, when you take a large population of people doing low carb diets, on average, over the long term, the LDL actually doesn't change significantly. But there's a subset of people that have, what's been called a hyper response, and the LDL increases. It seems to have to do with the best explanation I've come across so far is really the one that was, put forth by Dave Feldman in his work, the lipid energy model, that when you're switching to this ketogenic metabolism and your body is using fat for energy, that fat needs to be trafficked through the bloodstream in increased amounts. And LDL cholesterol is, the primary way that our body accomplishes that. And that seems to be why the LDL goes up. Now, what's important is in the vast majority of cases of people that have this increased LDL, this hyper response, when you do that advanced testing, what you see is it's the large particles that have increased. It's not the small particles that have increased. And that explains why it doesn't seem to be problematic.
Okay, so can you just tell us that test for the particle size that every person needs to order before they freak out about the LDL? What's the name to know those particle sizes?
Yeah, like I said, again, it's that NMR or advanced lipid panel. And, there's a little bit of a caveat here. Outside of the United States, it can be difficult to get this test done. We have international clients in our practice, and in a lot of countries, it's very difficult to get that test. So one of the other things we can talk about is some other tests that you can look at to at least give you an indicator as to whether or not, your LDL cholesterol particles are likely to be problematic or not. If you can get the test, great. I think that's the best way to do it. But the unfortunate reality is a lot of people can't get the test. And there are some other things that we can start to look at to help us try and figure out if, if the lipids are likely to be problematic or not.
Okay, let's talk about those tests. I'm very, very curious because I'm not in the US. I'm sure that many of my audience, some people live in the US, some people don't. But it's also good to have these tests handy to understand if you can't get the particle test done, other tests that you might want to do. Can you list those tests, please?
Yeah, so you ultimately want to figure out if you have inflammation and if you have insulin resistance. And if you have neither of those things, it's very good chances that your LDL is not going to be the problematic kind of LDL. So on the inflammation side of things, the most common test I see and I recommend is what's called a C-reactive protein, CRP. Sometimes you'll see it called high sensitivity CRP or HSCRP. And that's kind of a general body inflammation marker. And we want to keep that, and again, it might vary where you are, different units and stuff. But here in the US, what we tell people is you want to keep it less than 1. Ideally, over 3 is definitely problematic. 1 to 3 is a little bit of a gray zone, but ideally we want to keep this less than 1. There are some other inflammation markers we can look at. We can look at things like ferritin, which is a indicator of inflammation, but also relates to your iron stores. So that one can be a little tricky sometimes. We have things like there's something called an ESR, an erythrocyte sedimentation rate. It's another inflammation that you'll see used. Some places you might see something like an IL-6, interleukin 6, used as an inflammation marker. And then uric acid. Uric acid, many doctors think of that in the context of gout, but uric acid is actually a decent overall inflammation marker, and we can use that as an indicator as well. So lots of options on inflammation, but like I said, CRP is probably the most common one that people are going to get.
Okay, the ferritin is quite interesting because I've seen some carnivores on our Go Carnivore community that say my ferritin has really increased when I'm doing carnivore. Why might that be? And also, what is the level that ferritin should be to show that you don't have the inflammation?
Yeah. So again, ferritin is basically a storage form of iron in our body. So ferritin is going to be affected by how much iron you have in your body, how much iron you're eating, and in a meat heavy diet, that may rise. But ferritin is also affected by inflammation, and this is why interpreting ferritin can get a little tricky. Um, when ferritin is elevated because of inflammation, it's problematic. When ferritin is elevated because your body is not processing iron correctly, there's a disease called hemochromatosis, where the body doesn't process iron properly and ferritin goes up. And that's problematic. That disease has been associated with heart disease. However, if your ferritin is elevated because you're eating a meat heavy diet and you don't have one of those other things, I don't think it's problematic. And I also see this in a fair number of my patients. And this is the reason that we check multiple inflammation markers, right? So we can get an overall picture and we're not relying on just one number. So for instance, if I have someone that their C-reactive protein is normal and maybe their uric acid is normal and, other inflammation markers are normal, and the ferritin is elevated and they're on a meat heavy diet, I'm not going to be necessarily concerned about that. And, this kind of talks to the complexity of blood work, right? And this is why it's not always easy to interpret this yourself. There's a lot of nuance with a lot of these labs. And, going back to how we started the conversation, this is what I think is so silly or ironic about LDL cholesterol, that most doctors have been sort of brainwashed into thinking that it is the end all and be all, and that we can reduce our health to this one number, when we know that these systems are so complex and there really isn't, one thing, one number that can be taken in isolation that tells us, everything about our health. We always need to be interpreting the total picture when it comes to blood work and when it comes to the human being in front of us.
That's one of the great things about you. It's really hard to find a heart doctor or a heart surgeon that also understands a ketogenic carnivore lifestyle. Even getting a doctor that understands carnivore is quite interesting. So, given that you see patients, heart patients, do you ever recommend a statin? Is there a place for statins with your patients?
Yeah, the place that I recommend statins is if I have someone that is, insulin resistant, does have inflammation, and their LDL cholesterol is high, and they don't want to do anything about the inflammation and the insulin resistance. They're not willing to go on a low carb carnivore diet or make the lifestyle changes. In that situation, there is a small benefit to taking statins. And what I help people to understand is that benefit is quite small. It's not this massive benefit that most doctors think it is. And there's a trade-off over the long run, and possibly in the short term, right? Statins, like every medication, they have side effects that we have to be concerned about. But like I said, if you're not going to do, what needs to be done to address these other factors, then in that situation, it may make sense to take a statin. You just have to understand that it's not really solving your problem.
What are the side effects that we're talking about here? Because personally, some members of my family, They take a statin. If they can hear from you, a cardiac heart surgeon, what are some side effects long term for people that don't change their diet, but they take a statin?
Yeah, so the two biggest long-term effects I worry about with statins, number one is that they increase insulin resistance. And, insulin resistance is the root cause of heart disease. So we're taking care of this cholesterol that, plays a part in the heart disease process, but we're actually worsening, a primary driver of the disease process. And that's why I think the benefit is so small with statins, because you're making one thing a little bit better, but you're making another thing worse. So that's top of my list reason that I'm not a big fan of statins. The second problem that I see with long-term use is the memory issues and the neurocognitive issues that come up with long-term statin use. And the other reason that I think statin use is so problematic is, again, because it gives people this false sense of security. It gives the patients and the doctors this false sense of security that they're taking care of the heart disease and that they're not going to get heart disease. And the unfortunate reality is today, the majority of the patients that end up on my operating table are on these medications and have been on these medications for years, and yet they still end up with the heart disease. So that's really why I am so critical of statins. It's because they've given this false impression of fixing the problem when they're not. A story for you: when I was going through my training as a surgeon, and I was deciding what area of surgery I wanted to specialize in, and this is early 2000s. And I, was talking to my mentors that I was really interested in heart surgery. I found it, interesting, and I like that area. And they all told me, don't go into heart surgery. There's going to be nothing for you to do in 15, 20 years because we have the answer to heart disease. Statins at this time were the most widely prescribed class of medications, and it was felt that we were going to eliminate heart disease. Well, here we are, 20 plus years later. I'm busier than ever as a heart surgeon. There's actually a shortage of heart surgeons in the United States. There aren't enough heart surgeons to do the surgery that needs to be done. And heart disease, like we said earlier, is still far and away the number one killer.
As Dr. Ovadia mentions, heart disease is still the number one killer worldwide. And there are really easy ways to stop this from happening, primarily through what we eat. And later in the episode, Dr. Ovadia will talk about the high-fat nutritional approach to help you fix existing heart disease and also prevent it. And I do want to point out that while heart health is so important, our mental health is also very important. And for those that don't know, I suffered from a mental health disorder from a very young age. It's not something that I wanted to share at that time. And it's not something I wanted to talk about with my family and friends as I was suffering. And what I found completely fixed me, along with a high-fat carnivore lifestyle, was to understand my emotions and my thoughts through therapy. And my therapist gave me incredible practical solutions, things like meditation, gratitude, diaphragmatic breathing, journaling, and this weird ice cube sensory activity. Basically, it redirects your focus. This has helped me so much, and that is why I have BetterHelp as a sponsor of today's video. BetterHelp is on a mission to help you achieve your health goals, whether it's a New Year's goal or like me, dealing with anxiety. And it's really easy to get started. All you have to do is fill out a questionnaire and you'll be matched with a therapist in as little as a couple of days. And if the first therapist doesn't feel quite right, you can easily switch to another one until you find someone you truly connect with. So if you feel that you're struggling or you might feel overwhelmed, you might want to consider therapy. Simply click on the link in the description of this episode or just head to betterhelp.com/primal podcast and get 10% off your first month of therapy. Is that why you wrote your book, Stay Off My Operating Table? Because you just want to help people not actually be on that table and fix their life.
Yeah, exactly. My role as a doctor, right, is to do what's best for the patient in front of me. And I know that, no matter how good I might be as a heart surgeon, no matter how good all the heart surgeons out there might be, you're never as good after you had the surgery as you would have been if you didn't need the surgery in the first place. And, as I came to this realization of, what we were getting wrong about heart disease and how we were failing these patients, I was obligated, I felt obligated to try and get this information out to as many people as possible. And that's, what led me to write the book.
Out of your 20 years seeing patients, what was the most challenging or difficult patient that you've ever come across?
Well, it's hard for me to point to one patient. But, what has become, I would say, most challenging group of patients is the younger and younger patients that I'm seeing. So, I mean, the opening chapter of the book is a unfortunate story about a young mother, in her 40s who presented with devastating heart disease and couldn't be saved. And, unfortunately, I see stories like that more and more. And when I started my career, 25 years ago now, um, we operated mostly on 70, 80-year-olds. We had 60-year-olds and the occasional 50-year-old. It was unheard of to be operating on 40 and 30-year-olds. And yet today I do that on a routine basis. So we're seeing the heart disease develop earlier and earlier. And, like I said, I no matter how good I am as a surgeon, right? If I'm doing this surgery on a 30-year-old, I know that they do not have a great, long-term prognosis, and their lifespan is likely to be cut short by this unless they address the underlying cause, what's really causing their heart disease. And that's why we need to get them focused on insulin resistance, inflammation, the things that we've been talking about.
Let's talk about the absolute root cause of heart disease. So people have the right information when it comes to fixing heart disease. First question though, if somebody has plaque in the arteries, can that actually be reversed through doing these dietary measures that we're going to talk about?
Yes, it can. I see it fairly routinely in my practice these days that we see, we use the coronary artery calcium scan to measure the heart disease, and we can talk about that in more detail. But based on coronary artery calcium scans, I do see scores going down now on a fairly regular basis. Now, what's important to understand, and what I tell people is, our main goal is to stop it from getting worse. Um, if it gets better, great. But as long as we stop it from getting worse, most people are going to be just fine. And so that's the main goal that I set, that we stabilize the disease. But we do now see many cases of disease starting to reverse.
Okay, so let's talk about insulin resistance and its role in heart disease, because maybe people don't understand how does that cause this. Can you kind of explain how an insulin resistant person can get heart disease from an elevated insulin state?
Yeah, so it turns out that there are a couple of pathways by which insulin resistance leads to heart disease, and this is interesting stuff, right? So the one I would say is most obvious is when insulin resistance progresses and people's blood sugars start to increase. That increased blood sugar causes damage to the blood vessels, and that's kind of the most obvious linkage between insulin resistance and heart disease. But there are a couple of other things that go on with insulin resistance that contribute to heart disease as well. It turns out that at a sort of cellular level, the mechanisms of insulin resistance. We're talking about the sort of receptors on the cell that are involved in this. There's some crossover with a chemical called nitric oxide. And people may have heard of nitric oxide. Nitric oxide is one of the chemicals that our body makes to help protect our blood vessels. So nitric oxide causes the blood vessels to relax and kind of enlarge some. And nitric oxide also helps protect the endothelium, that lining of the blood vessel that we're trying to keep intact. And when you're insulin resistant, it causes your nitric oxide levels to decrease. And so this is another reason why insulin resistance can cause heart disease. The third pathway that I would talk about is the inflammation we were talking about earlier. Insulin resistance causes inflammation in the body. That inflammation, among other places, can damage the blood vessels and again lead to this heart disease process. So there are actually multiple reasons why insulin resistance causes heart disease. And what's interesting is the studies that were done back in the 1960s, 1970s, before we became so focused on cholesterol, really showed that when tested for properly, nearly every patient that presents with heart disease has insulin resistance.
Do you think then people need to focus on fixing the insulin resistance and not focus on the cholesterol?
Yeah, I think insulin resistance needs to be first and foremost. We can argue about whether or not you still need to focus on cholesterol, right? And I would rather have someone focus on both than, only focus on the cholesterol and ignore the insulin resistance, which is the most common thing I see these days, right? And again, as we were talking about, the vast majority of the time when you go to see your doctor, if they're talking to you about heart disease, they are focused on your cholesterol and your cholesterol only. So, when I'm talking to my colleagues in cardiology, and I don't necessarily start off with you're wrong about cholesterol. What I start with is, okay, but let's also think about this other thing, the insulin resistance.
What do you think about red meat in the sense of heart disease? Does it cause heart disease?
Absolutely not. That is one that we can say 100% red meat does not cause heart disease. It never has, it never will. And it's just unfortunate that, I spend so much time and many others spend so much time trying to undo this myth. And it was a total myth. It was never scientifically proven in any, good way that red meat causes heart disease. And we find ourselves in this situation where we now have to disprove something that was never proven in the first place.
So even for me, I eat a lot of red meat because obviously I do a carnivore diet. My the total cholesterol is elevated, LDL is elevated according to what the doctor says, but in the presence of low HbA1c, low blood glucose, low triglycerides, I am pretty healthy, right?
Yeah, it sounds like it to me. And, the only thing I would recommend to someone like yourself to kind of make extra sure about this is go ahead and get that coronary artery calcium scan and see what's going on in your arteries. And also understand that, for most people, right, who have come to a carnivore diet or low carb diets in general, right, they've come to it later in life. And there may have been 40, 50, 60 years of not doing that, right? And so we might see some damage to your arteries. We might see some plaque in your arteries. Don't panic about that. The key is now we want to follow that over time. And after you've been on the low carb carnivore diet for a year or 2 years, repeat that scan and see, is the plaque still accumulating? Has the plaque changed any? That's, another key thing to uh, realize, as we're trying to figure out this whole picture around heart disease. Because if you have some plaque, but it's not to the point where you're having symptoms or, you need a stent or anything like that, as long as we stop it from getting worse, we're going to be fine. And if you do the right things, there's a chance you might see some reversal.
Perfect. So the next thing I should do is get a CAC score, and we're going to talk about some other tests that people can do as well. Do you think butter causes heart disease?
Butter does not cause heart disease.
Why?
Again, you shouldn't be asking why doesn't butter cause heart disease. The people who think it does cause heart disease, I say why. Um, Show me the mechanism, right? Because we know butter doesn't cause insulin resistance; it reverses it. We know butter doesn't cause inflammation; it reverses it. And they'll say that butter, contains saturated fat, and it does, but saturated fat does not cause heart disease either. That has been thoroughly disproven at this point. So I always turn that question around and say, explain to me why we thought butter caused heart disease in the first place. That's really the question we should be asking.
Okay, let's talk about what causes the actual cause of heart disease. In terms of foods, I've got buckets here so people can understand bucket 1 to bucket 5, and then you can elaborate more on these. So, bucket 1 is ultra processed carbs and sugars. In that bucket includes bread, pasta, cereals. Why is that bad and why does that cause heart disease?
Yeah, so this is a big one, and what's important to understand about these things. There's two components of processed food that we need to think about. There's the highly processed carbohydrates, the sugar, the grains that are highly processed. Those are going to contribute towards insulin resistance, and then we have the highly processed fats that are oftentimes used in these products, the things like vegetable and seed oils. And vegetable and seed oils, again, there are many things they do within our body that lead to inflammation and insulin resistance. And so combining these two is especially problematic. And that's why ultra processed food is really the primary um, driver in our modern food environment of not only heart disease, but, the other metabolic diseases as well.
So, if somebody's thinking, what is an ultra processed food? Because we have different definitions now. Give an example. If you go out and about, what are you going to see that's an ultra processed carb or sugar?
Yeah. So, what I tell people is if your grandmother or great grandmother wouldn't have recognized that as food, that's an ultra processed food that you shouldn't be eating. If it has an ingredient list, right, that you don't know, like all the things on that ingredient list aren't something that you could go out into nature and, grow yourself or pick or kill, then, that's an ultra processed food that you shouldn't be eating.
Okay, and that includes cereals because cereals is an ultra processed food, multiple ingredients. We're told it's healthy. Oatmeal is not healthy either. The next one, which is bucket 2, is you mentioned industrial seed oils, but that's even when you are cooking with oils like vegetable oils, canola oil, that is going to contribute towards heart disease.
Yeah, definitely so. And again, these oils are highly inflammatory, especially when they're heated. So cooking with them becomes even more problematic. Now, understand the whole process of making these oils involves heating them and chemically treating them. And this is what makes them so toxic, so problematic, is the damage that's done to them even in the process of making them, and then that can be further amplified by cooking them and bringing them up to high temperatures. So I am not an advocate for cooking with them at all, and I'm not an advocate for having them as an ingredient in anything that we're eating.
Okay, next one is fake heart healthy foods like margarine.
Yep. And again, these things are all contain these vegetable and seed oils. And, the vegetable and seed oils are really a major part of this story, right? We came to believe, right, that lowering cholesterol was good for our heart health. And then we had these oils that lower cholesterol. And I don't deny that they lower your LDL level. It's just a question of whether that's actually good for your health and how they're doing that. And we now know, we have all of the levels of evidence, right, that we talk about in science that implicate these things in our as a contributor to poor health, right? You can look at and again, many of us are rightly critical of epidemiologic data. But, we have epidemiologic data showing these things are problematic. We have the interventional trials that are done with these vegetable and seed oils, and they've all been a failure. They don't show the benefits that they're supposed to show. They don't reduce death overall. They actually increase it in a number of the trials. And they really don't reduce the heart disease deaths when the trials look at it in a good way. There have been a couple of poorly done trials that have purported to show this, but those are, now at this point, discredited trials. And we know the biochemical mechanism by which they cause the damage. When these alterated fats get into our mitochondria, right, the power plants of the cells, they gum up the machinery, right, because our bodies can't process these fats properly. Saturated fats, that we get from animal products that are in nature, and even the monounsaturated fats that might be in things like olive oil, our bodies know and can utilize these. These polyunsaturated fats were never in our environment to anywhere near the amount that they are today. Yes, there are small amounts of them, right? And even in something like, beef, there's going to be very small amounts of these unsaturated fats. They're non-processed, right? So they haven't undergone that whole chemical processing to, and then, they're not oxidized generally when they're introduced from something like beef. But that's a whole lot different. And then the amount of them is really what is the problem. These things have gone up by 50, maybe even 100 times in our food supply over the past 50 to 70 to 100 years. And that's when we see heart disease, diabetes, Alzheimer's disease, all of these things increasing. It's interesting. I'll admit my thinking on this, has evolved over time. And, I started off by thinking it was the carbohydrates, it was the sugar that was the primary cause of the damage. I now think that it's the vegetable and seed oils that caused the damage in the first place. And then once we have that mitochondrial damage and we have the insulin resistance, now the sugar and the carbohydrates become problematic because our body can no longer process them properly.
And it's interesting to note that the ultra-processed foods contains the refined carbohydrates coupled with the vegetable seed oils, which is exactly what you're talking about. I think people can get confused by that, as probably health experts are also confused which ones comes first and what's the mechanism of disease and why does disease happen. The next one is pretty easy. Alcohol, that's bucket 4. As a carnivore, do you ever have alcohol?
It's pretty rare for me, to be honest. Alcohol is not beneficial to our health. And again, despite what you hear, right? You hear these studies that say, a glass of red wine a day is going to be beneficial. And it's not, right? What those studies actually show is that it might mitigate some of the damage from the food we're eating, right? It has these antioxidants that maybe can help lower some of this oxidative damage that we've been concerned about. But all in all, alcohol is not a benefit to your health. And it's interesting to me to see how many people, as they do a low carb carnivore diet, as they get healthier, they just simply lose their desire for alcohol. It just, again, probably has to do with the brain chemistry. And I certainly put myself in that category. So, I'm not an absolutist about it. I'll have a drink every once in a while. And when I do, it's going to be zero carb alcohol. Usually for me, it's going to be a scotch or a bourbon without, any sugar mixer in it. And a lot of times I end up not even finishing the drink. I've turned into a cheap date, you could say.
It's interesting that the level of alcohol, it affects people on a ketogenic diet. So, if you could have a drink on a normal carb diet, you probably will feel the effects much more on a ketogenic diet. Last bucket, that foods that are going to cause heart disease. So anything packaged with bad ingredients. So even things that are marketed as healthy for you is not good. Look at the pack and look at the ingredients.
Yeah, realize that those labels about them being heart healthy or other health claims, these are all advertising. In the case of the heart healthy label from the American Heart Association, that is a paid for label. The food company has paid the American Heart Association to put that on the label. So it is pure advertising. And the only thing that you can believe on a food package is that nutritional label. Now, I'll caution that even that you want to be a little suspicious of, because there are games that get played there as well. But look at the ingredient list. That's the key. And the ideal foods, they don't have an ingredient list. They don't need it. You look at it, you know what it is. It's a steak. It's, it's a vegetable, right? It's a fruit even. You can look at it, you know what it is. It doesn't need an ingredient list. Or, maybe you're looking at something that has an ingredient list that is only combining, those things that what they are. I really don't believe any of these chemicals are healthy for us. There's a lot more focus on the dyes and the stuff that are going into these foods, and which ones of them may not be healthy. And in reality, I don't think any of them are healthy. And the other kind of thing that people need to sort of come to grips with is they're just not necessary, right? You can survive without these things. So why would you be introducing them into your bodies?
Do you think that a high-fat diet could actually fix heart disease?
Yes, I've seen it.
In patients, you've seen it.
In patients, right? They go on the high fat, low carb, diet. They eliminate the processed food, right? And it's important what type of fat. You want to be using the natural animal fats and the minimally processed fruit fats. Coconut oil, avocado oil, olive oil. These things are okay to use as well. I prefer the animal fats, but those things are okay. And eating a lot of those fats in combination with animal protein, I've seen it improve heart disease. So I don't have to really theorize about it. I've seen it, and I know it helps with heart disease.
Okay, I like to play a game here. I'm going to give you some foods and you tell me, can you eat as much of this as you want until you feel satiated? And that's going to help someone fix their heart disease. First one, beef.
Definitely so.
How about eggs?
Definitely so.
How many can you eat a day? How many eggs?
I don't know that there's a limit. I do, I have become a little bit more cautious, and I talk to people about the source of the eggs, right? Because you do have to be concerned about what that chicken is being fed. And if they're being fed a bunch of corn and soy, that can translate to more of these polyunsaturated fatty acids in the egg. Now, again, I don't know that the polyunsaturated fatty acids in that situation are as damaging and as concerning as they are in the bottle of vegetable and seed oil, but I have become a little bit more cautious about, the source of your eggs. I think if you have well-sourced eggs, the chickens are truly eating what they're supposed to be eating out there in the pasture. You can eat as many of them as you want. If you're not sure about the source of your eggs and what the chicken was eating, you might want to, be a little bit more careful. That doesn't mean don't eat eggs, just means maybe you don't want to do a dozen a day of those types of eggs.
So if I have pasture raised eggs, as I do, highest quality, I have 6 in the morning. My husband has a dozen. Totally fine. Totally fine.
Totally fine.
This is going to be hilarious. People are going to think you guys are crazy for saying that. But if they can understand that the saturated fat and the good fat is good for you, it's going to fix your heart and fix heart disease, they'll understand that eggs, beef, and lamb is the next one, is good for you. Is lamb good?
Yeah, lamb is excellent. Lamb in many ways might even be better than beef. And I know some people, that might trigger them a little bit, but lamb actually, when you look again at that kind of fatty, the profile of their fat, it probably has some advantages over beef, especially, the other thing is that most lamb, right, is grass fed, grass finished. We haven't really gotten into grain finishing lamb. They haven't figured out how to ruin lamb quite yet, as they have with, some beef. So lamb is a great food to be eating.
I didn't know that. I'm going to eat more lamb then if it's kind of all grass fed because I currently have grain fed beef. It's delicious, but if I can get grass fed lamb and it's at the same price or even cheaper than beef. What do you think about? So we spoke about butter. Does butter unclog the arteries?
So I don't know that we can say that butter unclogs the arteries, right? Butter has the fats that aren't going to clog the arteries. And if you're substituting those for the fats that do clog the arteries, indirectly, there can be I guess, an unclogging effect, right? Some of it is what you're taking away as much as what you're eating.
I love asking these questions because you're very on point and diplomatic. In a way, it does unclog the arteries, but you have to be careful to say it doesn't directly. But if you're not having these other fats, it is going to help have good, healthy arteries. Okay, last few. Raw milk, good or bad for heart disease?
Yeah, I think raw milk is great for our overall health, and I have no concerns about it when it comes to heart disease.
Wow. Raw cheese,
Raw cheese, great as well. Yep.
honey.
So honey, I think, is going to be situational. If you're not insulin resistant, if you're active, I think honey can be incorporated into the diet safely. The problem is that most people are insulin resistant to some degree, and therefore they are going to, honey, which is sugar, is going to be problematic for them. But I think if you are, like I said, if you're insulin sensitive, you're active, you have good muscle mass, and you want to incorporate some type of sugar, I think raw honey is one of the best types of sugar that we can incorporate into the diet.
Okay. Any limit on salt if somebody wants to fix heart disease?
If it's real salt, there's no limit. If it's processed salt, that's where it becomes problematic. So, the reason that salt has become associated with high blood pressure and heart disease is the vast majority of salt, at least in the Western diet, comes from processed food. So it really became a marker for processed food. The unprocessed, good sea salt or good Himalayan salt, whatever it might be, that is not problematic, and people shouldn't limit that in any way.
Okay, so we've been talking about some foods that kind of cater towards a carnivore diet, except for the honey. I want to open it up to people that might include some vegetables, maybe do ketogenic, low carb. Is that okay to fix heart disease? And what vegetables are and salads are okay?
Yeah, so I think it can be. And again, this is where you need to be assessing, where you're starting from. The more insulin resistant you are, the less you can tolerate carbohydrates, even if those are coming from a clean, vegetable source, like, broccoli, cauliflower, something like that. Um, and so, these are situations where I oftentimes like to use with my patients something like a continuous glucose monitor, that they can see how their bodies are reacting to those things. And then the other problem that I guess gets introduced, right, when you start talking about salads and vegetables is, are you putting dressing on them? What's in the dressing? Are you, cooking these things in vegetable and seed oils as opposed to, cooking them in butter, for instance? So you want to be thinking about those aspects of it as well. But in general, I think most people are going to be able to tolerate, a low level of these lower carbohydrate vegetables. And you just have to, like I said, kind of tailor it to your situation. How insulin resistant are you? How active are you? What's your muscle mass like? these things are going to affect how much you might be able to tolerate.
Makes sense. Pairing this, depending on what the person wants to eat with fasting, do people need to encourage a fasting window to fix heart disease?
I don't think you need it. I think it can be a very useful tool. Again, it's not only when we start thinking about how much carbohydrate we eat, we also should be thinking about the frequency with which we're eating them. And fasting periods also have other advantages. Fasting can be a good tool to get you into a more ketogenic metabolism, can kind of force your body to start, burning your body fat. And especially when we're talking about that visceral fat that's going to affect our insulin resistance. So I do encourage fasting with my patients. And I do think it can be a very powerful tool. And again, there are different ways to use it, right? You can talk about the intermittent fasting, you can talk about the extended fasting. And I think those things do need to be sort of personalized, again, to where you're at, where you're trying to get to. And this is where working with a good practitioner, not just doctors, but practitioners of all sorts, can be helpful to help, the individual kind of figure out a good plan for them.
Absolutely. So fasting along with the foods, carnivore foods are fantastic, but low carbohydrate, higher fat foods is important to fix heart disease. Let's talk about the tests. We mentioned this is the test to fix heart disease or to identify whether you have heart disease. So we mentioned that the LDL is not a really good indicator. What do you think about LDL versus triglycerides? Which is a better marker?
So triglycerides are actually clearly a better marker when it comes to heart disease risk, and the studies are pretty consistent on this. It just, the reason, quite frankly, that doctors don't focus on triglycerides is we don't have a good medicine to lower them, and like or correct them, I should say, right? Because again, not clear. With triglycerides, I think it is a little bit clearer that lowering them is good. And the way to most effectively lower triglycerides is to cut your intake of carbohydrates. So triglycerides are a more important marker than LDL. And if your triglycerides are low, we were talking about earlier, some of the ways you might be able to figure out, should I be worried about my LDL or not? Generally, when triglycerides are low, the quality of LDL particles is going to be better.
And how low is low for men and women?
So under 100 milligrams per deciliter, which is the US units, is what I advise for a triglyceride level. Another sort of thing you can look at is the ratio between your triglycerides and your HDL cholesterol level. Now, again, important, if you're figuring out this ratio, you need to figure it out in US units. You can't do the ratio in the millimoles. So triglycerides divided by HDL, ideally, you want to keep that ratio less than 1.5.
Okay, so you mentioned that triglycerides is an important marker. What about fasting insulin?
Yeah, fasting insulin is another great marker. Strongly encourage everyone to check it. If you're not checking it, you're really not getting a complete picture of what's going on with your, we'll call it glucose or carbohydrate metabolism. People, and unfortunately doctors, get fooled into believing that as long as their sugar levels aren't high, they're okay. And that may not be true, because you can have an okay sugar level, an okay hemoglobin A1C, but your insulin level is high, which means that your body's working extra hard to keep the sugar under control. And that's the precursor, that's the early stages of insulin resistance, which is problematic. So checking a fasting insulin level, very important.
And the level for fasting insulin needs to be between 3 and 5. Is that correct?
I always say under 7 is ideal. Under 10 is okay. Anything more than that, you want to be concerned about. And this is something else that becomes tricky when you're checking a fasting insulin level. The lab usually says the normal value is up to 20 or even 25 with some labs. And so again, if you have a doctor who doesn't quite understand this, they might look at your level of 17 and it's green, right? It's in the good zone and they say you're okay, but it's not. You really want to keep it in the single digits, under 10, and under 7 is really ideal.
Okay, so speaking about ranges, because ranges aren't exactly accurate, for cholesterol, can you provide the ranges for total cholesterol? We mentioned triglycerides, but also for LDL and HDL.
Yeah. So again, I don't necessarily set a range for total cholesterol or LDL. HDL, if you are a man, you want to keep that over 40 milligrams per deciliter. And if you're a woman, you want to keep it over 50 milligrams per deciliter. And then the triglycerides, like I said, you want to keep that under 100. If your triglycerides are low, under 100, if your HDL is high, over 50, you probably don't need to worry about what your LDL or total cholesterol is.
Okay. Next question is, because I'm thinking, as I'm asking you about cholesterol, and we mentioned the CAC score, which is the coronary calcium score, isn't it better just to get that coronary calcium score and not look at the cholesterol? Because that's going to show you if you've got plaque in the arteries.
Yeah, it may be. The reason that I like both is just the practicality of I can check labs multiple times a year with patients. And as things are changing, we can be using those to kind of judge, if things are moving in the right direction. The CAC score, is more practically done maybe once a year or even maybe every other year. So I just find that it doesn't provide enough of that feedback, right? It's too delayed of a feedback loop if you're only relying on the CAC score. But again, yeah, this is an important, uh, um, nuance about the LDL cholesterol is that if you have a CAC score of 0, that really, the studies have shown that there's no benefit to using statins in people that have CAC scores of 0, no matter what the LDL cholesterol is. I, again, like to put a whole picture together. There's no one test that tells us everything. It's all a matter of getting the right combination of these tests to allow you to be able to fully understand your health and what's going on.
And then what about a coronary CT angiogram? How does that differ with a CAC score, and why should someone get that?
Yeah, so the CT angiogram differs from the coronary artery calcium scan. It's a more detailed study. It can allow us to see not only the calcified plaque that we see on a CAC scan, but we can also see the non-calcified plaque, and we can get better detail about the blood vessel and how blocked up it might be. Now, the downside of the CT angiogram is that it involves a higher dose of radiation. It's typically going to be more expensive. And therefore, it's a test that I don't typically use as often, right? I'm comfortable getting a CAC scan on a patient year after year after year. I'm not comfortable getting a CT angiogram every year. So the CT angiogram I reserve for people that we're concerned about, either based on what we see on the CAC score or maybe because of symptoms that they might be having. And then, we can use it in that same way to judge progression over time, but it's usually going to be something I might be getting every, let's say, 3 to 5 years on a patient, as opposed to every year that I'm getting the CAC scan.
Okay, last question. If someone does a high fat diet, how quickly could they reverse existing heart disease?
Yeah, again, that's going to be somewhat variable. And I don't have a good answer because I only do CAC scores every year, right? So we see it go down year over year in some people, but I don't know if it would have gone down if I had scored, if I'd scanned them at 6 months or 3 months, right? We don't do the scans as often. So it's a little bit more difficult to answer how quickly the heart disease starts to reverse. And again, more importantly, how quickly does it stop progressing? And the way that I think about that is when we reverse the insulin resistance and we reverse the inflammation, that's probably when we stop it from getting worse. And how long that can take, again, is going to vary person to person. If you've had, 40, 50 years of severe insulin resistance, if you've been type 2 diabetic, for a long time, it's going to take longer to reverse it. And in some cases, we can't completely reverse it. And that's okay, as long as we're improving it, right? A type 2 diabetic that comes to me and their hemoglobin A1C is 10 and they're on 4 medications, and we get them down to a hemoglobin A1C of 6 on 1 medication, I'm happy with that, right? Yeah, it might not be ideal. It's not perfect, but if that's as good as we're going to get because of all the years of accumulated damage, we're going to take that and they're in a much better situation. And we're hopefully slowing the progression of, whether it's heart disease or other diseases that we're concerned about.
Absolutely. You've got a website called ifixhearts.com. Is that correct? It's a very easy website. Do you currently see patients worldwide?
Yeah, so I have a telemedicine practice. We see patients throughout the United States, and we do have international patients as well. There are some limitations when we're working with internationally. I can't directly order the testing like I can in the US, but we make it work with most people, either working with their local doctors or, I have some people that once a year they'll travel to the US, they'll get the testing done. We can do things like that as well. And we also have other ways that we work with people besides the telemedicine practice. We have, other sorts of programs as well. So it's all at ifixhearts.com. I'm very proud of the great team that I've built there. It's not only me. I have a nurse practitioner, I have health coaches, I have all of the people behind the scenes. And it's really been rewarding to see how that's been growing and how, the success that we've been getting for people.
Wonderful. Well, I'm going to leave all the links, including for your book, Stay Off My Operating Table, in the description of this episode and iFix Heart. So if people want to come see you, get a consult, they can do that as well as with your team. Dr. Ovadia, thank you so much for your time. And I'm sure we're going to see you. This has been the 4th time. I'm sure we're going to see you again.
Yeah, it's been a pleasure. Always love coming on and discussing with you. I'll give you a sneak preview that there's going to be book number 2 coming out probably towards the end of 2025 or early 2026. So if not before then, we'll definitely make sure to come back on and talk about that one.
Thank you for joining me today on this episode with Dr. Philip Ovadia. If you'd like to know more information about how to naturally reverse heart disease and why cholesterol matters, simply go to the link in the description of this episode, click on How to Reverse Heart Disease, open that, and then you'll see all the information there. If you're learning from and enjoying these free episodes, please hit the subscribe button. You can also find me on other social media accounts. I'm on Instagram and on X under the name of the Primal Podcast. Now, if you love this episode with Dr. Philip Ovadia, you'll love another episode I did with Dr. Nathan Bryan. We discussed everything nitric oxide. In case you don't know, nitric oxide is a naturally occurring molecule that happens in your body. So it is responsible for lowering inflammation and also lowering blood pressure. Dr. Bryan will talk about the ways that we are destroying our nitric oxide and the natural ways to increase it. One of them is avoiding mouthwash and changing your toothpaste. Finally, thank you for your interest in root cause healing, and I'll see you next week.